So before going to start today's discussions, I would like to recapitulate, or rather I would like to discuss. So mainly three things I have discussed yesterday. Number one is the concept of health promotion. Number two, action areas of health promotions. And number three, rather four. Number three, principles of health promotions. And last one, methods of health promotion and education. Okay. So now, perhaps everybody has gone through 2 or 3 lines. What is health promotion? Loudly, can anybody say? Health promotion is a process of enabling people to gain control over the determinants of health and improve health. These 2 lines only. If you can explain these 2 lines, the concept will be clear. Health promotion is the process of enabling people to gain control over the determinants of health and improve health. Now you know what are the determinants, right from heredity, environment, lifestyle, socioeconomic conditions, utilization of health services, income, educations, occupations, whatnot. If you can control these determinants, then we can expect health promotions. But yes, one thing is required, that is supportive environment. Next, healthy public policy, strengthening community action, reorient health services and develop personal skills. If we can do it, then we can empower the community so that the community can control the determinants. If there is a healthy public policy, then it will be easy for the planners, implementers, as well as the community people to follow these things. Yesterday I told you about the different examples, showing the different examples. And next, the main thing is support the environment. If the environment is not supportive, we cannot do anything. Say for example, this is the classroom situations. I require the supportive environment. Then only you can hit or you can pay attention. What is supportive environment? Number one, the speaker or the lecturer must have confidence. Number two, you as a learner, you should have the minimum need. Yes, you require learning. Number three, here is physical environment. See, this temperature, calm, quiet, and logistics are there. Every arrangement is there. That is supportive environment. These things we require. Okay. Then it will be easy for us to promote health. Clear? Okay. Now I will start about 2 concepts, that is IEC and BCC. So basically nowadays there are 3 concepts. One is IEC, next one is BCC, and third one is SBCC. But this is somehow I will not discuss in details, just I will tell the meaning only because this is not in your curriculum right now. Okay. IEC, I means information good, E means, C means here B mean behavior, C means change, next C means communication. Good. S means social. Good. day by day we are going from general to specific, specific to very specific. This is general, this is specific, and this is more specific. Okay. But we are concerned about these two things, IEC and BCC. Fine. So this full form: information, education, communications, behavior, change, communications, SBCC, social and behavioral change, communication. But the goal of all these concepts is same. Goal is to change the undesirable behavior. To change the undesirable behavior. That is our main goal. Okay. So in both the concepts, our objective is K to A. K means knowledge, A means action. Knowledge to action. The goal is the same. In case of IEC, the goal is to change the undesirable behavior. In case of BCC also, to change the undesirable behavior. In case of social behavior change communication also same things. But the path is different. IEC was general, BCC was specific. Still BCC is going on, and then SBCC is more specific. Okay. Now, if we stress the little bit history of health educations. So again, go back to health education, concept of health education. Here also, objective health education is change the behavior. In 1792, the concept of health education was developed. So before that, also health education was there, but not in the formative way. So in 1792, this concept was developed. What for? To disseminate informations for the prevention of disease by changing the unhealthy behavior. Since 1980s, it was considered as most cost-effective intervention for prevention of health problems by changing the undesirable or unhealthy behavior of the individual, group and community. It is assumed that knowledge determines attitude, and in the long run, attitude determines behavior. It is assumed that knowledge determines attitude, and attitude in turn influence behavior. The three terminology K, A, P, knowledge, attitude, practice is equal to behavior. We can say again not KP. Right now we are telling knowledge, attitude, beliefs, values and practices. KABVP equal to behavior. But the thing is that why simple health education failed? Because you see, we are telling our objective is to change the health behavior. We are disseminating informations. That's all. Assuming that if you disseminate informations, that means if you can provide knowledge, automatically attitude will be positive, and if the attitude is positive, then many a times it influences our behavior. But there is some exception also. But without considering other things. What things? Say for example, we are rational, we are human being, we believe in logic, is it? So, when we say something else, people want proof. What is the evidence? Where is the evidence? Without evidence, I cannot say yes, it is correct. But education alone is not sufficient to initiate a behavior change. Why? Because the target population requires access to preventive measures. If I say that mosquito transmit malaria, people can say how it can be possible. Is there any proof? If we can show the proof, then people will believe and behavior will be changed. But in health education, that was not there during that time. So there was a gap between knowledge and practice, evidence-based actions. In order to plug this gap, knowledge to actions, IEC came in practice in the late 1980s or early 1990s. So how change has brought about from health education to IEC? Health education is there. Okay. In health educations, we did not that much consider about the proven things. We believe that knowledge influence attitude. If knowledge is positive, attitude will be somewhat positive, and if attitude is positive, then behavior will be changed. But in reality, it was felt, no, it is not always possible. Many people, many times require proof. Again, it depends on belief systems. If you people believe me, what I will tell, you will carry out. But sometimes it happens, what is the evidence? That means that's why we require the reference books from where we have quoted it. Is there any proof? For that reasons, IEC came into effect in early 90s or late 80s. Now, we can discuss about IEC, Information, Education, Communication. Information, what it is? It prevent health problems, it promote health and maintain good health only by giving informations. Next, educations. Educations help to change in lifestyle or behavior for the betterment of health, and communication to a process of exchanging ideas, feelings, attitudes and informations. So there are three terminologies. Now communications. Okay, little bit I will share with you about the concept of communications, though it has been discussed very many times in the classes. So what is communication? Communication is a process of exchanging informations, feelings and thoughts for changing the behavior. That is communications. Can anyone tell what are the elements, minimum elements that must be involved in a communication process? Elements of communications. If I say barriers of communication, sometimes you can say what are the barriers, but elements, then we can proceed, because everything is related to communications. Okay? Whether I am giving or you are giving or imparting knowledge, that is through communications. Maybe verbal, maybe non-verbal, but you must know what is communications, what are the elements of communication. Sometimes principals forget about that, you should know it, and the barriers of communications. Because if there is a barrier, then communication is not effective. If our communication is not effective, you cannot expect change in the behavior of the human being. So what are the elements of communication process? This is repetition, nothing but okay. First element is source or sender. Is it so? There must be a source, is it? Think about the epidemiology for communicable diseases. Then it will be clear. In epidemiology, to transmit the disease, especially in communicable diseases, there must be a source or reservoir, is it? Then follow. Then it will be easy for me to compare. There is a source. From source, then you must go through a path. Is it? Mode of transmission. Then host. Is it? Here also same thing. Source must be there. Then there must be a channel. Okay. Mode of transmissions, the channel. Source means maybe a person, maybe organizations, maybe a book, maybe a newspaper. That is the source of knowledge. Sender means the persons who is transforming or exchanging or sending the message. How? Through a channel. What I am using now for communication, better communication, I am using the LCD projectors. Okay. Channel, I am transferring the message to you. Okay. You are the, in case of disease, okay, you are the host. Okay, entering the disease agent, host. Here you are receiving. That means you are the receiver. Okay. These are the elements of communications. Source or sender, then message, that you are disseminating the message through channel to whom? To the receiver. Receiver will receive the message, interpret the message by using sensory organs. Okay. Then give response whether you have understood or not what I am trying to tell you or trying to discuss with you. Okay. So this is communication. Okay. So communication is a two-way process. In the last class, I discussed the methods, one way or two-way. Two-way process of what? For exchanging ideas, feelings, thoughts and attitudes and information. So this is IC. Now the definitions, you see, IEC, Information, Education and Communication, is a pre-planned effort or endeavor with specific objectives. When I am trying to tell you, there are some objectives. What is my objective of this class today? The learners will be able to comprehend the concept of IEC and BCC and their differences. That is the objective. So, pre-planned, that I have planned yesterday or day before yesterday I have planned how I will discuss with the students about these two concepts, IEC, BCC and their difference. So, educational endeavor with specific objectives to reach specific audience. You are the specific audience. By skillful use, I am using these LCD projectors, using this blackboard, okay, skillful use of appropriate methods and materials. This is the materials, methods I am using. What? I am using this lecture forum because I am asking questions, you are answering the questions, specific methods, materials with specific time period within 1 hour. Clear? Now, the again definition of IC given by WHO. Same thing, the different way. IC public health approach. Perhaps right now you are becoming the 3rd year or 4th year. Okay, going public health, you know what is public health? Say public health approach. What for? Aiming at changing or reinforcing what? Health related behavior. Behavior, the component you know. Component of behavior, knowledge, attitude, beliefs, value, practice, these are the components of behavior. Okay. So, health related behavior means the behavior that is related to health, the behavior that influence our health, whether it will be healthy or not, it depends upon your behavior, health related behavior. That means washing hands before taking food, using what? Mosquito nets. So, these are health related behavior. Okay. In a target audience. Here, my target audience are you, covering a specific problem and within a predetermined or predefined period of time through communication methods and principles. This is IC. If we explain this definitions, what do we get? This definition helps us to have a clear objective. So, for example, the specific behavior to change, because you see before that, before my class, perhaps you did not have a clear concept about IC and BCC. So, this is your specific objective. Now, you will be able to know what is IC, What is BCC? What is the difference? Why IC has turned to BCC, again BCC has turned to SBCC, like that. The passive behavior to change. Now your behavior will be changed, it is expected after my class. As far as this concept of IEC or BCC is concerned, okay. Target a specific audience. Right now, my target are you, okay. MBBS third year students. Here, for example, lively examples, mothers of children below 5 years. That is our target. All the mothers having children below 5 years, that is the target. To change the behavior. Which behavior? Address a specific problem. That means during the diarrhea, they did not offer the fluids. Now, through IC, we are trying to change the behavior of the mothers so that they will offer fluids and they will continue feeding child with diarrhea rather than attempt to so many change at a time, specific only, okay. And next one, within a time frame, set a time frame within which the results, that is change in behavior, are expected to occur, that is IC. Clear? Now, three components. Informations, we have to percolate information first, but percolating only or disseminating information is not enough, okay. Through informations we can do what? We can only change. What type of change you can bring about? Just aware. You are not aware about this terminology, information. Now we know what is IC, what is just the terminology. Then education. Next one is education. Through educations, we are also trying to bring about a change, but it is not again enough. Then communications. Okay. Now why IC is necessary? Because it creates awareness, it increases knowledge and change attitude. It is not that much expensive. It ensures feedback mechanism. You see, we have used one shirt or t-shirt, okay, and we have written improve feeding during diarrhea. Then these are the resource materials of IC: books, pamphlet, posters, flip chart, flip book, what not. This is print media. Then we can use mass media, televisions, radio, internet. These are the mass media. Now, always we think to change the behavior at the individual level, at the group level, at the community level at large. So, levels of IC at individual level, individually, if case of complicated cases, we follow this individual, provides opportunity to develop knowledge, acquire skills and confidence. It also creates awareness first, reinforce to sustain behavior. Sustain behavior means the already behavior has changed, but it will remain sustained. Long run, long time, it will not again change, revert. At the community level, we inform first. What methods you use? Yesterday we have discussed, that is mass methods, okay. Through mass methods, using mass methods, we try to inform. Then through group method, we try to persuade the people, encourage the people and motivate the people for adopting healthy behavior. This is IC. Now I will start about the BCC. Okay. Now question comes, okay. Question comes, why from IC to BCC? Objective is the same, knowledge to action. But the main thing, the main difference between IC and BCC is, while IC considers only knowledge, attitude and practice of the people, okay. In case of BCC also, the objective is to change the knowledge, attitude and behavior, ultimately practice, change the behavior. But in case of IEC, IC did not, or rather right now do not consider the other factors, excepting the factors that are predisposed within the individual. That means through IEC, we have tried to change the knowledge of the individuals, fine, the attitude of the individuals, the practice of the individuals, without considering other forces which influence the behavior of the individuals, behavior of the public. In case of behavior, within the individuals or outside the individual, there are some forces. Within the individual means what? Say for example, you would like to change my behavior. I would like to change your behavior. Fine. I am considering only your knowledge. If I boost up your knowledge, if I provide your knowledge, then attitude will be changed. Then automatically it is expected that your behavior will be changed without considering the other factors. What type of factors? Say for example, your behavior, there is outside self. Your behavior is also influenced by your friends, by your family members, by your colleagues, by your teachers, by other environmental factors. Is it clear or is it clear? Not clear? আমাদের আচরণ আইসি কি করছে? অন্য কারো কথা ভাবছি না, যাদের ব্যবহারের আচরণের পরিবর্তন করতে চাইছিলাম তাদের কথাই ভাবছি। তাদের ব্যবহার বা আচরণ যে অন্য কারো দ্বারা ইনফ্লুয়েন্স প্রভাবিত হতে পারে, আদার সামাজিক যে ফ্যাক্টরগুলো, যেমন সমাজের নর্মস, সমাজের রীতিনীতি, সমাজের প্রথা, দ্যাট মিনস নর্মস, কালচার, সোশিয়েটাল নর্মস, ট্যাবুজ, ফোকোয়েজ, মোরেজ, যে আমাদের রীতিনীতি প্রথা আছে, সেইগুলো ইনফ্লুয়েন্স করছে আমাদের ব্যবহারকে, তবেই আমাদের ব্যবহারের চেঞ্জ হবে। এইটা কিন্তু আমরা কনসিডার করিনি আইসিতে, বাট বিসিসিতে আমরা সেটাই করছি। দ্যাট ইজ দি মেইন ডিফারেন্স বিটুইন আইসি অ্যান্ড বিসিসি। ক্লিয়ার? আমরা মনে করেছিলাম এতদিন পর্যন্ত আমরা যদি তোমাদেরকে নলেজ দিই তাহলে তোমাদের ব্যবহারের পরিবর্তন হবে, কিন্তু বিসিসি বলছে না, অনেক সময় ফেল করছে। কারণ কি? তোমার ব্যবহার তোমার রুমমেটের উপর নির্ভর করছে কিনা বলো। তুমি যখন পড়াশোনা করছো তোমার রুমমেট তোমাকে ডিস্টার্ব করছে, তোমার এনভায়রনমেন্টটা কন্ডিউসিভ নয়। That's why I told you the supportive environment. BCC considers that the societal behavior change. We have to change the behavior of the society. We have to change in the long run the norms of the society, the culture of the society, because culture influence the behavior of the individuals. That's why BCC came. Okay. Concept of health education, 18th century, then IEC, 1980s, then BCC, 1990s to 2000. That was the BCC. Now again, 3 theories has been used while framing the BCC framework. BCC, 3 theory they have considered in case of BCC. First theory is health belief model. Second is theory of planned behavior. Third one is social cognitive theory. What is that? Health belief model. There is a model. Okay, BCC consider that. In case of health belief model, there are few components. First is perceived susceptibility. First one, the people will go to the doctors for treatment if they suspect that something wrong is there. They feel, they suspect, I may suffer or I am suffering from disease. Second one is perceived severity. People will go to the doctors when they will think it is severe, মারাত্মক, তীব্রতাটা বেশি। তো perceived severity, first perceived susceptibility, perceived severity, and third one is now cost benefit analysis. আমি যদি ডাক্তারবাবুর কাছে যাই, if I go to the medical officers, how much cost is involved, যতটা কস্ট আমি ইনভলভ করব, আমি আজকে আমার ওয়েট চলে যাচ্ছে, আমি ব্যালেন্স দেখব কোনটা বেশি, তা পারসিভ কস্ট ম্যানেজমেন্ট দেব, পারসিভ বেনিফিট আমি দেখব, পারসিভ ব্যারিয়ার আমি দেখব। এতগুলো কনসিডার করছে কে? বিহেভিয়ার চেঞ্জ কমিউনিকেশনস। নেক্সট থিওরি কি আছে? থিওরি অফ প্ল্যান বিহেভিয়ার। ম্যান ইজ রেশনাল, ম্যান ইজ লজিক্যাল, every behavior is caused, and for each and every behavior there is some reasons. আমরা যে আচরণটা করি প্রত্যেক আচরণের পেছনে একটা কারণ আছে। তাহলে মানুষ কি করবে? লজিক দিয়ে চলে। পিপল আর রেশনাল, সো উইল থিঙ্ক, is there any logic behind this? If I adopt this behavior, why I will adopt this behavior? Plan, they will think about this behavior. The behavior is guided by the rationality. And third again, no, not always. So their emotions are influenced. Man's behavior, emotions is influenced by the other factors. The other factors means outside the self. আমার ব্যবহার, আমার আচরণ, আমি কি করব, অনেক সময় নির্ভর করছে পরিবেশের উপরে, আমার সারাউন্ডিংসের উপরে, আমার ফ্যামিলি মেম্বার্স, আমার পেয়ার গ্রুপস, আমার ফ্রেন্ডস, আমার নেবার্স, ইভেন কোন কোন ফেসিলিটিগুলো অ্যাভেলেবেল আছে তার উপর নির্ভর করছে। আমি বললাম যে যাও ডাক্তার দেখিয়ে এসো, ডাক্তার মে নট বি অ্যাভেলেবেল, ডাক্তার আছে কিনা এই সবগুলোর উপর নির্ভর করছে। সো দ্যাট ইজ সোশ্যাল কগনিটিভ থিওরি। সো BCC is based on all these theories. After 2010 onwards, this SBCC came in existence, social and behavior change communications. There is a holistic approach, I told you, holistic, when we discuss about this health promotions. Each dimensions has role, influence, specific influence, and again their interactions has also specific role. It's holistic, recognizing social, cultural and structural influence of what? Influence of the behavior. These society, social norms, cultural norms and structure influence the behavior. Okay. Now the definition of behavior change communications. Behavior change communication is an interactive process. Okay. In health educations, we also told about the mass approach, but in case of BCC, we believe in interactive process, direct, face-to-face communication, interactive process. In interactive process, communities, because our objective is to change the behavior of the whole community. Community, what for? To develop tailored message. We did not tell about the tailored message. We told about the message. We are disseminating the message. But now in case of BCC, to develop tailored message. Tailored message means, perhaps you know about the tailor. Tailor কি করে? What is the function of the tailor? Activity of the tailor. Tailor কি করে? কি করে? জামা কাপড়কে তৈরি করে। তোমার জামা কাপড়ের সাইজ আমার জামা কাপড়ের সাইজ এক না। প্রত্যেকের অ্যাকর্ডিং টু দি নিড, অ্যাকর্ডিং টু দি সুটেবিলিটি অফ ইচ এন্ড এভরি কাস্টমার্স, টেলার্স আর ইউজ টু স্টিচ অ্যাকর্ডিং দি ফিগার। Likewise, in case of BCC, we will prepare the tailored message according to the suitability of the each and every group of people. Then only it is expected that behavior will change. Develop tailored message and again approach. Say for example, according to the individual approach will be different. একজনের ক্ষেত্রে যদি আমি কাউন্সিলিং করি আর একজনের ক্ষেত্রে আমি বলবো হয়তো ইন্টারভিউইং আছে, different methods we have. So according to the suitability of each and every individuals, we develop the message as well as we take the different types of approach using varieties of communication channels. There are different types of channels, is it? Radio, TV, internet, that is mass, newspaper, this is our posters, flashcards, all the channels. So again, depending upon the situation, depending upon the suitability of each and every individuals, we select the channels to develop positive behaviors. Our objective is to develop positive behaviors, healthy behavior, and promote and sustain individual, community and societal behavior change. You see, the behavior of the whole community or the society will be changed, not only to change and maintain appropriate behavior. That means sustainable change. Change will be sustainable, behavior will be sustained, not revert back to the previous positions. একবার চেঞ্জ হয়েছে, চেঞ্জ থাকলো, নতুন করে ব্যাক করে চলে এলো না। This is behavior change communications. Okay. Now BCC is primarily concerned with creating a supportive environment. That is very important. Until unless the environment is not supportive, behavior will not be changed. If at all it change, again it will be revert back. So it requires supportive environment which enable people to change their behavior from the negative to positive sides. But how? How supportive environment can be created? In BCC, it creates enabling environment. How? Through number one, identifying and reducing barriers or blocks. Say for examples, I am disseminating the informations to you. What for? You can comprehend it, you can change your level of knowledge, level of attitude, and practice will be changed. At the same time, I have to see, is there any barriers? কোনো কি বাধা রয়েছে যে বাধার ফলে আমি যা বলছি তোমাদের কানে ঢুকছে না, তোমাদের হৃদয়ঙ্গম হচ্ছে না, you cannot be able to comprehend. So we have to identify it. In case of BCC also, this BCC identify the barriers and try to reduce the barriers. Say for example here, physical barriers, there is no physical barriers, seating arrangement is very good, temperature is very good, AC is there, all the logistics is there. So there is no physical barriers. So we have to identify the barriers in case of BCC, reduce the barriers, and next then promote benefits or boost up. BCC facilitates individuals and community to transfer information into a desirable behavioral action. Now BCC employ what? A systematic process beginning with formative research before trying to implement behavior change. What BCC can do? Number one, do research. Through research, we know what are the characteristics of the individuals. According to the characteristics of the individuals, we prepare the message, that is called tailored message, which is formative research. We do behavior analysis of the community, followed by then plan communications. We plan how to communicate. We plan it, then question comes about implement it. Once it is implemented, then we try to monitor. That is question of this one. Feedback, monitoring and evaluations. Okay. Next again, just reinforcing, nothing but reinforcing the concept BCC. Why BCC? BCC টা কেন দরকার আছে আমাদের behavior change communications? BCC is used with or beyond IEC. That means IEC, BCC is a part of IEC. BCC means IEC plus something else. In case of IEC, everything is there excepting what? Excepting the societal norms. সোসাইটির কথা চিন্তা করছি না আমরা, সোসাইটির কালচার, সোসাইটির নর্মস, সোসাইটির বিহেভিয়ারকে আমরা চেঞ্জের কথা ভাবছিলাম না in case of IEC. But in case of BCC, we are considering the societal changes, societal behavior. Okay. So definitely BCC is within IEC. Is it? Sorry. IEC is within BCC plus something else. Because IEC focuses on changes of unhealthy practices. BCC also focuses the same things leading to unhealthy behavior. But IEC mainly focuses on awareness and knowledge dissemination, but without this one, which is important, without considering the societal behavior. What about the practice in the society? What cultural norms, what cultural practices, what traditions, as far as so many things are concerned. Say for examples, in our society, if we think about the food habits, food pattern, broadly we can classify this food pattern into two. One is Amish or Niramish, veg, non-veg. In case of IEC, we did not consider about who are veg, who are non-veg. Say for examples, if we discuss about the importance of, or we try to change the food patterns, okay, as far as this diet is concerned, we require balanced diet. Okay. In case of IEC, without considering who are veg, who are non-veg, we advocated this protein and we emphasized upon animal protein without considering these food habits of the individuals, veg or non-veg. So those who are veg, they will listen. I mean, They will hear, but they will not take it, they will not implement it, because they are not habituated, or rather it is prohibited in their culture to take animal protein, fish, meat, egg, etc. This is IEC. We thought, yes, behavior will be changed as far as the balanced diet is concerned, but in case of IEC, we are thinking who are veg, who are non-veg. What about the cultural pattern? Is it? Then we advocate. Also we can advocate in case of BCC, as far as this high protein is concerned, soybean, so vegetable, soybean, we can advocate soybean. So this is the difference. Considering the societal behavior, which is essential to change the unhealthy behavior. That is the main difference between IC and BC. Other differences there, I will show you right now. Number one, knowledge to actions. In case of IC, in case of BCC, is it? Our objective is to provide knowledge and it will turn into actions. Then we change the behavior. Okay? Both in case of IC and BCC. People need to overcome mental blocks or practical barriers. There is cost, access, belief system, societal norms, culture, taboos, etc. In case of IC raises awareness only. That is, mosquito spread malaria. In case of IC, we are telling mosquito spread malaria. While BCC tackles the reasons why people are not using the mosquito nets. Okay, that is formative research. They cannot afford the cost. Number one, they do not know how to use them. They do not even believe that due to mosquito bite, malaria can cause and motivates adoption. In case of IC, only we are spreading the knowledge. Okay, mosari khatao, malaria tarao. This is the message, IC. But we are not considering this. Why they are not using? What is the reason behind it? Do they know about the causes, how mosquito spreads malaria? So this is BCC. Next, deeper engagement. In case of BCC, participative, always participative, rather we are striking in the heart. In case of BCC, or IC only mind. No. In case of BCC, we are striking the mind as well as striking the heart. BCC uses tailored message. Tailored means according to the suitability, according to the necessity of each and every individuals, and interactive methods to strike the heart, not just the mind. It fosters deeper understanding and commitment. Third, in case of BCC, target will be specific target, but in case of IC, general. BCC uses specific, often interactive, I told you. Interactive and face-to-face always. Communication methods to influence individuals and community behavior. IC very often forgets to address the barriers. What are the barriers? What are the pitfalls? What are the blockers? But in case of BCC, identifies these barriers and work to overcome the obstacles like social barriers, then the social norms, okay, economic barriers. মুখে বলে দিলাম মাছ খাও, মাংস খাও, ডিম খাও, but you have to think about the cost. Do the community can afford the cost? That you have to think. Then you have to advocate. In case of BCC, we consider the economic things and then behavior, which prevent positive change and implement intervention program for more sustainable change in behavior. Now the question, IC is a part of BCC. Is it yes or no? IC is a part of BCC? Yes. IC is a component of BCC. All the materials, say for example, yesterday I have discussed about the methods of health promotion and education. Methods of health education is the same, methods of health promotion is the same, methods of IC is the same, methods of BCC is the same. So, BCC uses the materials also same. IC like posters, leaflet, pamphlet, flashcards, flip chart, etc. to create awareness. Then layer BCC strategic. BCC strategic interactive method, that is colloquy. I told you colloquy is more effective because Why colloquy is more effective than panel discussion in the committee level? Because committee representative, audience representatives are involved in this colloquy. For that reason, it's more and more interactive. People will think it is our people, so it is our problem. They will think about our problem. BCC strategy, interactive method, colloquy, workshop, community dialogues, tailored message, etc. to convert that awareness into actual behavior change. Now, in a formative way, again, I would like to tell you about the difference between IEC and BCC. What is the main difference between IEC and BCC? Number one, focus. In case of IEC, focus is disseminating information and promoting awareness, and also to change behavior without considering the societal norms. In case of IEC, but in case of BCC, everything is there. Plus, promoting specific behavior change with considering the societal norm. That is most important. That is most important. If we want to change the behavior of the people, we have to think about the society. We have to think about the society's norm, culture, their traditions, their belief systems. Then only we can be able to change the behavior of the individual beings. So BCC do that. Next, in case of IC, methods are passive. But in case of BCC, all the methods are interactive, that is active. Goal is the same, change in behavior. In case of IC, in case of BCC also, change in behavior. Outcome, BCC is equal to IC plus something else that I told you. IC plus something else. What is that? Other considerations like societal behavior, culture, factor influence behavior of the individual, other factors. Say for example, whether facilities available, I have to say, I have to think, then I will tell. In case of IC, আমি বলবো প্রতি মাকে বলবো যান বাচ্চাদেরকে ভ্যাকসিন নিয়ে আসুন, ভ্যাকসিন প্রিভেন্টেবল ডিজিজ থেকে রক্ষা করার জন্য। কিন্তু বিসিসিতে বলবো যাবেন, যান অমুক দিনে যাবেন, একটা নির্দিষ্ট দিন বলবো, নির্দিষ্ট টাইম বলবো, নির্দিষ্ট দূরত্ব বলবো, কোথায় পাওয়া যাচ্ছে সেটাই বলবো, আদৌ অ্যাভেলেবল আছে কিনা দেখবো, তারপরে বলবো। ইন কেস অফ বিসিসি দ্যাট কনসিডার দিস ওয়ান। সো দিস ইজ the difference between IC and BCC. BCC activities do everything with people's participations in case of BCC, but in case of IC, many times we forget about the people's participations and people's involvement. In case of BCC, honor the culture, the norms, the traditions, the beliefs, the values and other social factors that influence behavior. Not only that, your behavior will be changed, but this will not entirely depend upon you. Apart from you, your behavior is influenced by so many factors that you have to consider. In case of BCC, we consider it. একজনের ব্যবহারের পরিবর্তন করতে গেলে তার পিছনে আর কি কারণগুলো আছে সেগুলো আমরা দেখব। In case of BCC, we do that. And last, role of BCC. It increases knowledge, simple. It helps to trigger and stimulate people for adopting positive behavior. Third, BCC promotes appropriate essential attitude change. As BCC strategies and messages are tailored, that is most important. For a specific group of people, these strategies are more efficient and more effective. BCC approaches are more sustainable. That means once change has been brought out, it will not revert back. BCC helps to increase learning and skills. It improves aptitude and feeling of self-efficacy. And last one, but not the least, that is most important, is consider the social and cultural factors to bring about change in human behavior. Okay, that's all about IEC and BCC. Is it clear? Everybody is clear? Three terminology I told you: health education, IEC and BCC. In case of IEC, consider everything, but without considering the influence of the societal norms to change the individual behavior. That IEC did not consider, but BCC considered that. And in case of SBCC also, it considers more and more about the society. Okay, So that's all. Okay. Now question may come. Difference between IEC and BCC. Question may come. IEC and BCC is the same. Or question may come, IEC and BCC is different. Or question may come, IEC or BCC is not same. Explain. Okay. So IEC, BCC is same or different? Answer is different. Why? So the main difference is, in case of BCC, consider the societal norms apart from increasing knowledge, attitude, beliefs, values and practices. But in case of IEC, only consider this knowledge, attitude, beliefs, values and practices without considering the societal norms. In case of IEC, not that much people's involvement is required, but in case of BCC, people's participation and people's involvement is must. Okay, that's all. Okay. তাহলে আমার health promotion, health education, health communications is finished. Now, একটা question আমি তোমাদের কাছে রাখলাম. One question. Think. If you think you cannot be able to answer the question, then I will come and discuss once again. Say for example, a specific problem is going on. Maybe diarrhea, maybe anemia, maybe other disease. The problem is going on in the community. Now, as a medical officers or as a block medical officers, fine, what is your role? Or how you can plan an effective health promotion and education program to combat this situation, to control these situations. বা তোমাকে বলা হলো প্রবলেম অ্যাজিউম করা, অ্যাজিউম না চলছে, কেউ রিপোর্ট দিল, কে রিপোর্ট দিতে পারে? লেম্যান ক্যান রিপোর্ট ইউ, আশা ক্যান রিপোর্ট ইউ, এএনএম ক্যান রিপোর্ট ইউ, or other health worker can report you that problem is going on in that area. What, how you can frame or how you can plan a suitable health promotion and education plan and implement it in that area. What are the steps? কি করে করবে? ওকে, কোশ্চেনটা রাখলাম তোমাদের কাছে, কোশ্চেন উত্তরটা তোমাদের কাছে রেডি করবে. If you cannot, I will discuss on this. Question may come in the examinations, this type of questions. So question may come from health promotion. That is my last class before exam perhaps. Okay, if you do not require any more classes. Number 1, health promotion concepts. What is health promotions? Number 2, principles of health promotions. Number 3, action areas of health promotions. IC, BCC, their difference. And again the methods, health promotion education methods, mainly panel discussions, mainly colloquy, symposium, or key. Yes, counseling. Okay, so these are the questions, expected questions may come in the examinations. Okay, is it clear? Okay, if you require any class regarding my subject, means my arena, health promotions, health education, health communications, then all the methods of health promotions, rather action plan, health promotion action plan, that I told you, health promotion action plan, how you can plan an effective health promotion action plan. So these are the questions that is expected in your final exam. I am not bothering about this internal. Okay, thank you.